the time for the Q&A sessions. So I would like to invite Dr. Ponte, who is joining me now, and Dr. Natapong for our Q&A sessions. We also have Dr. Hagiwara joining us online at the moment. So good morning and Ohayo gozaimasu, Dr. Hagiwara. Okay. So now I'm going to take a look at the questions from our participants. The first questions will be about the pediatric colonoscopy. So it is the questions for Dr. Hagiwara. You have mentioned several techniques in pediatric colonoscopy. There have been two questions regarding the use of caps in pediatric colonoscopy. First, do you use it in every cases? And the second question is, which type of caps do you use?
Thank you for the questions. So we actually we use caps for all colonoscopy, and the type of the cap is I think Olympus product. We use.
So thank you, Dr. Hagiwara. I would like to ask Dr. Natapong as well about the using of caps in polypectomy. Do you find it is useful?
Okay, thank you very much. And about the cap-assisted colonoscopy, theoretically may help to enhance polyp detection rate by pushing out the colonic wall because of some the polyp, particularly very small polyp, may hide behind the colonic fold. So it may help to enhance the detection rate and may help to facilitate EMR resection. So, but there's, to my knowledge, there's no conclusive evidence of its benefit, particularly in children. There's a meta-analysis reported recently. However, in my experience, I haven't applied it as much in the practice. We use the standard colonoscopy for the polypectomy.
So there is also another questions about polypectomy. What is the chances of bleeding after using cold snaring for polypectomy?
If you choose to use a cold snare for very small polyp, in my experience, I don't experience the post-polypectomy bleeding after using the cold snare compared to the hot snare. The hot snare is more, because of when you use the hot snare, the polyp size is greater than when you do the cold snare polypectomy. So I don't have any experience of the bleeding after the cold snare polypectomy.
So I have a questions for Dr. Ponte. What is your suggestion for bowel preparations in infants and young children? Are there any tips or tricks for that?
I believe there's no standardized, again, but even less evidence in terms of the small children. I have interest when listening to Dr. Kagiwara talks on using enema. I think people use enema alone with regard not just for the pain or bleeding, but also in small children, they probably or people may be familiar with just using the enema alone. The oral medication that a lot of people use is lactulose. Probably when you are older than 6 months or even like a month, you use lactulose to prep bowel before that.
Okay, thank you, Dr. Ponte. So I have another questions for Dr. Hagiwara. Could you provide more specific tips for doing right turn shortening in colonoscopy?
Thank you for your questions. Actually, so it is hard to explain. That's why so it's it's like an automatic procedure for me. So I think the practice is most important to acquire the skill. So, but I think everyone can perform. So even you have a lot of experience for colonoscopy, but sometimes it takes time to acquire the skill.
Well, thank you. So moving back to Dr. Akrapon, there are questions about polypectomy. Which technique do you use to prevent snare entrapment?
I think you have to communicate with the nurse and check the snare that it fit with the size of the stalk that you see from the colonoscopy or not. If the distance when at the snare is very large or very long compared to the size of the stalk of the polyp that you see on the colonoscopy, you have to be careful that you may the snare may be not in the good position, and you have to readjust or open it again and try to adjust it. I think the coordination between the endoscopist and the nurse is very important before you apply the electrical current.
So thank you, Dr. Akrapon, for your answers.